Hey guys, it's Olivia Shu, and today I'm going to be teaching you how to properly insert and remove a G-tube button. So first thing I've done, I've already washed my hands, I have my gloves on, and I gathered my supplies. So first you just want to check and make sure that you have the correct size that the doctor had ordered. So for our patient today, which is going to be my son. So we have a 14 French, that's the size of the actual button, and 2.3 centimeters, that's just the length of how small how small or how big the button is. So I'll show you guys here in a minute. So we're going to have the patient lay down, and he's a little scared, as we usually are. So if you can go ahead and lay down for me for just a second. Thank you so much. And we usually offer some support. So whether it be like a little item to hold on to or just some support to hang on to. So there you go. There's your little toy. There's your little piranha plant. It's his favorite thing right now. That's what's in. So we open up our box. And this is what your typical G-tube kit is going to look like. So we've got your syringes, a 5 mil and a 35 mil. We have two different types of G-tube extensions. We have some lubricants, and it's really kind of hard to tell right now, but you do see the G-tube button right there. And there's just another little device if you have trouble inserting it into the stoma or the hole. And then we've got some just gauze there, just to make sure that everything is as sterile as it can be. So, thank you very much. Hold up your shirt. And if everyone would like to see what an actual G-tube button looks like inside the patient. So it's this one right here. And this is how we feed medications or any type of food, liquid, diet. He has Pediasure. So what we want to do first is we want to make sure that all of our supplies are laid out. So I have my gauze right here, and that will hold on to the previous G-tube. So what I want to do is I want to grab my lubricants and just open it up so that there's just a big enough hole, and then dispose of that little piece. If you want to close that, you can. And he is a little nervous. And just put that inside the lubricant so it's just nice and moist, and you don't want it to be too dry when we go into the body because that'll just hurt the patient. So we've got our gauze, and then I'm gonna take my 5 millimeter syringe, and he is getting a little nervous. You're doing just great, baby. We're gonna get started now. So what I'm gonna do is I'm going to take my syringe, and I'm just going to put it into this little hole right here.
I'm doing great.
Yes, you are. No owies. And then I'm just going to gently pull all of the water out. And this is deflating the balloon. So you want to get all that water out. And it looks like we have 4 millimeters of water.
I'm doing great.
Yes, you are. All right, so what we're going to do is we're going to go. I'm going to have you breathe out. Ready? 1, 2, 3. Whoop.
That's doing great.
And so this is all just the bile and the stomach juices. We want to get rid of all of that, obviously. So I'm just going to stick this right here, and I'm going to cover up your stoma. Okay, we're going to take just a small break. Lay down. You did do it. I'm so proud of you. So why don't you just lay your head back all the way for me? You're doing great. So we want to make sure that none of the stomach contents come out from the stoma.
Ew.
It's very gross.
What's that stuff?
So then what I'm going to do next is I'm going to take my lubricated G-tube.
Mommy.
And I'm going to make sure that the packaging is the right one, so I can even open up the button if I like. It says 14 French, 2.3 centimeters. So I'm verifying that it is the correct one. You're doing great, baby. Why don't you just talk to your stuffed animal? Talk to Piranha Plant. Tell him how you feel.
I don't need great products.
So we actually want our patients to be a little agitated because this will be able, this will help us be able to know that we put it in the correct spot. So what we want to do, we want to make sure that the hole is not exposed because inside bacteria will get inside and it could cause an infection. So what we're going to do, okay, buddy, are you ready? We're going to take a deep breath. Here we go. And he's very nervous right now, so we just try and reassure the patient. Ready? 1, 2, put your head down just a little bit. 3, we're going to just gently push on it. Perfect. So now I'm going to take my water, and we're going to put that brand new water in there. And we're going to fill this up.
Mommy, I just do great.
You did great. We can do it up to all 4, or we can do just 2. It does not matter, whatever your order says. See, mine had come out just a little bit, but that's okay. So what we want to do next is we just want to tug on it just a little bit. Okay, and that balloon is intact. So that's perfect. And then finally what we want to do is we want to check and verify that we have our button in correct placement. So what we want to do is we want to take our extension tube here, make sure that everything is closed before we put that in the patient because then it'll come out really quickly.
Can I tell Pona?
If you can lay down one more time for me.
And just put it in.
Yes, and can you open your button for me? You can also get the patients really involved, and that will help them feel a lot better.
And we gotta get the cover.
I will get the cover. That's the last thing we knew. So if you can open up that button for me. Wonderful. Thank you. So how we use our extension is we want to line up, if you see this black line right here, and you see this black line on the extension. So we want to match those up and gently just push that in there. And then I turn it 3 times. 1, 2, 3. So it's not going to come out. It's locked. So what we want to do is I usually take some of my 35 milliliter syringe, stick it in there, and then I ask the patient, open up your clip for me. Thank you. And I'm going to pull, and that's perfect. I see that G-tube content. So we're going to shove that back in there just for a moment. And then we would put some new water in there just to make sure that we push all that back in because we don't want that to hurt. So that's how you properly insert, remove, and take care of a G-tube. Thanks for watching.
Thanks for watching.